Switching gears here, as the world eagerly awaited the arrival of a coronavirus vaccine, volunteers participating in trial phases took on a vital role during a devastating pandemic. Many participants were vaccinated while still balancing other priorities, like politics. Joining us now is Rich Fitzgerald, Pennsylvania's Allegheny County executive. Rich, thank you so much for joining us. You participated in the Moderna trial, so can you tell us a little bit more about what that has been like, especially while juggling your already existing duties in politics?
I did, and we obviously have a health department in Allegheny County, and our health department director indicated that she was going to participate in it. Dr. Deborah Bogan kind of convinced me to do it. I will tell you, I'm not a medical person by training, and I was a little bit reluctant. I had never even heard of Moderna, to be honest with you. So I knew it was a trial at our University of Pittsburgh, which has a wonderful medical school and has great tradition. Actually developed the polio vaccine many years ago. So the tradition is great. Went through the whole screening process. They ask you a whole lot of questions about your medical history, allergies, medicines you're on, those kind of things. I guess I passed, so they let me into the trial. I got the first shot in early September. No reaction, nothing at all. Oh, by the way, I didn't know they wouldn't tell you if you were getting the placebo or the real vaccine, and I still don't officially know that. But it's a 4-week delay between shot number 1 and shot number 2. Right before I got shot number 2 in late September, the doctor came in and told me that I might have certain symptoms that might come about: fever, headache, achiness, fatigue, that type of thing. It would only last for a short period of time, maybe 12 hours or so. And that's exactly what happened. I got the second shot and I did get some fatigue. I got the achiness, a very slight fever. That was about it though. Since late September, I have not had any other symptoms. So apparently I did okay. And then I found out a couple months later, obviously, that Moderna has a 98.5% or whatever the efficacy rate that they've been rated at, and are about to be approved for emergency authorization from the FDA. So glad to be part of it.
Rich, thank you so much for sharing your experience. Really appreciate you sort of breaking down what it's been like for you, especially because a lot of health experts have been warning about that reaction and potentially people experiencing some mild symptoms. I think it's something that makes people a little bit hesitant to get the vaccine. We've also seen research showing a significant portion of Americans don't plan to get it. So what would you say to sort of calm those fears or let people know about your experience in terms of why they should opt for this vaccine?
Well, the symptoms are actually from what I'm hearing from the medical professionals, that tells you that your immune system is working. And that's what you want to be able to fight off the virus. So the symptoms, again, were very mild. And when I say slight fever, had I not been taking my temperature as part of the trial to be able to log in every day and send them the information, I really wouldn't have even known about it. It was only like 1 degree. So, and then the achiness was really mild. It's almost like when you work out one day and then maybe the next day you have your muscles are a little sore. It was that type of thing. So it wasn't anything, but to, talk about the risk reward, to know that you're now vaccinated against this deadly virus, that you're protected. All of us were wearing masks, we're doing distancing, we're doing all these things to prevent catching this virus. The vaccine is the light at the end of the tunnel. It's the way forward for all of us to get on the other side of this pandemic and get back to normal.
Absolutely. And you're talking about participating in Moderna's trial. We know that we are still waiting for emergency use authorization for that particular vaccine. But I also want to bring up the Pfizer vaccine because it says it has millions of unclaimed vaccines in its warehouse. What's your reaction when you hear something like that?
A frustration. They need to make as much of it as they can and distribute it as quickly as they can. There are people in long-term care facilities that are really needing this. Our frontline workers who are out there exposing themselves every day. It's unconscionable that there would be sitting. When I saw the Pfizer press release that went out late last night saying that they have millions of doses sitting in their warehouse because they're waiting for word from the federal government to tell them where to send it. It's very frustrating. So we need to make sure that we are arming we're in a war. we are in a war against this virus. And the people that have ammunition in that war are doctors and nurses and medical practitioners. We would not send our soldiers into battle with the ammunition sitting in the warehouse. We, in essence, are sending our medical professionals into battle without the ammunition. We need to get that ammunition, that vaccine, out into the community so it can be distributed and make people safe as quickly as we can.
That being said, what is your plan for rollout, and especially when we are talking about the general public for the vaccine in your county? Are you able to share any of the details that you're working on?
We're still, yeah, we're prepared. We're waiting, and part of it is, you know, the way the federal government will do this is they'll send it through the states, and we certainly work closely with our state leaders, Governor Wolf and his team, Secretary Levine, Secretary of Health at the state of Pennsylvania. So we'll be working with them, but we have multiple plans out in how we can distribute it, how we can obviously keep records, because in some of these vaccines, it's a 3-week period between shot number 1 and shot number 2. On the Moderna one, it's a 4-week period between shot number 1, shot number 2. After you get that second shot, you kind of have to be monitored for about 15 minutes or so, sometimes as much as 30 minutes if you have allergies. So there is a little bit of logistical issues that have to be worked out. We've got all those plans in place. We're just ready for the supply. And they're starting to distribute. The Pfizer one got distributed for shot number 1 to many of our hospitals this week so that the frontline medical personnel can have that. We understand this week coming up, the Moderna is going to be distributed and Pfizer to a lot of our long-term care facilities, our nursing homes. Again, people that are most vulnerable and most susceptible to this virus.
And really quickly, just about 30 seconds left with you. Because you mentioned the governor, I do want to talk about Pennsylvania being put on pause to stop the spread. Do you have a message for citizens as we head into the holidays on how we can curb these cases rising?
It comes down to what they tell us to do, the masks and distancing, and really eliminating or minimizing gatherings. And that's hard to do, obviously, as we come upon Christmas and New Year's and the holiday season. We all want to be together. But to keep people safe, what they will tell you is one of the easiest ways for this virus to spread is to be sitting down, eating, having a meal with people that aren't in your household. So let's keep people safe. The vaccine is coming. We want it to get there quickly, but we want to make sure we stay as safe as we can over these last few months.
Such an important message. Rich Fitzgerald, Allegheny County Executive, thank you so much for joining us and telling us more about your experience.